All right. I think we're rolling here. Good morning. Good morning, Ron.
Morning, Davidito.
Good morning, Dr. Eva.
Good morning.
Doctora, how are you guys doing this morning?
I'm doing well. Thank
Yeah.
you. Yeah.
So do you have your El Salvador coffee in hand?
Yeah, sure.
Cold brew, baby. Cold brew.
Nice, Ron's got the cold brew going. And have you made cold brew with the ENLACE coffee yet, Ron?
I did. It was very good.
Yeah.
Especially if you put a little bit of cream in there. You got to put that cream in there.
Nice.
Nice.
Well, I don't know. Yeah, if you guys but I'm pretty stoked about this month's coffee. This was the first month that we actually had some El Salvador coffee, and it's the Pacamara coffee, and it was pretty incredible. So the first couple months of the Guatemalan coffee was also good. But tell us in the comments as well which coffee has been the best so far, and also what is your preferred brewing method if the AeroPress has been awesome for you. So
we're getting fancy here, man.
Yeah, man. So which is your favorite, either Guatemalan or the El Salvadoran Pacamara, and what's your preferred brewing method? So, but we're not actually here to talk about coffee, but I just couldn't help it because this coffee's too good. This morning, we are going to get an update about what's going on in El Salvador, Guatemala, and Nepal. We haven't talked much about Nepal yet on this show, or even with a lot of the updates, but it has been incredibly active over there as well. And so we got Dr. Ron, we got doctors, plural, on here. For those of you who didn't know, Ron is now Mr. Doctor Ronaldo Bueno. Or is it Doc? Oh, you're on mute, Ron.
But Dr. Eva's the only doctor that counts.
Yeah, she's the medical doctor. Medical doctor that counts, and she
can actually do something with her degree.
Yeah, well, Ronaldo's doing something too, so
yeah, right.
But yeah,
don't ask me to check on moles or anything like that, because I can't. That's not the kind of doctor.
Yeah, and for those of you who don't know, Dr. Eva, she certainly is still a practicing medical doctor, even among the staff in El Salvador, right? Because like anybody's got a problem, it's Eva.
Yeah.
Can you help me with this? But yeah, Eva is actually a medical doctor, but she also has a master's degree in public health, which obviously that is coming into play right now in the COVID crisis. So she has a master's degree in public health. She's been with ENLACE now since 2013 and started as doing like community service hours, right? Or what's it called?
Yeah.
The like internship hours.
Yeah.
And which clinic did you start at?
La Estancia.
Yeah.
And Avelines, I went a few times too.
Yeah. So yeah, she was out working on the northeastern region of the country at two different clinics we had there. Basically doing like her internship hours, and then just has been with ENLACE now since 2013. And she helps to manage all of the projects and programs for ENLACE El Salvador normally, and now she's helping to manage everything. She's in English we're calling her the czar over all of the different relief and recovery efforts. We were making fun of the czar name. It's not as common, but it is. That's the proper terminology. Although, what are we calling it in Spanish? What's your role in Spanish?
Comisionada.
La comisionada. That's pretty good.
Yeah.
La doctora comisionada. I love it. No, but it's pretty incredible because Eva now is actually, coordinating the commissioner. Maybe commissioner is better than czar, Ron. Yeah. What do you think?
Well, I've gotten her like a Russian hat, but I guess I can get her like a Batman suit, like as the commissioner or something. We could switch it to Gotham leader. She is the commissioner over all Gotham operations or something.
There we go. Yeah. So she's la doctora comisionada, Doctora Evelyn Berdugo. And so anyhow. But for those of you who don't know, things have been locked down in Central America in particular. And so, Dr. Eva, why don't you start out by kind of giving us a quick update on what the situation is in El Salvador, Guatemala, and Ron's going to get into Nepal a little bit more here in a minute, but tell us specifically about Central America, what's going on in El Salvador and Guatemala in terms of level of infections and where we're at in the lockdown period.
Sure. So the number of cases show a relevant increase in the last days. So Guatemala has reported more than 17,000 cases and almost 800 deaths. El Salvador more than 6,000 cases and almost 200 deaths. So the mobility restrictions are being the same at the last days. At Guatemala, you can able to go outside during the day, except some regions like Chimaltenango and Sololá, where we work, that the church have to reorganize to continue their activities with the community because the lockdown it's more than normal. So at El Salvador has started phase 1 on economical reactivation activities that has caused an increase of cases compared to the lockdown.
Yeah. So, and tell us a little bit about how that lockdown is in El Salvador. You know, I mean, I'm up here in the Midwest and we're having in the Midwest United States, and we're having arguments about whether or not anyone should even wear a mask, let alone there haven't been any restrictions in terms of really going out from, you know, a legal standpoint. But like, how has the lockdown been? Like, for instance, how many times have you been outside, Eva? How many times have you been?
Me?
Yeah.
Well, I've got maybe 16 because I go outside once a week for the supermarket, the pharmacy, and all the things. That maybe 16 times during all the lockdown.
Right. Yeah.
Which is since March 15th, right?
Yeah.
It's 3 months,
yeah.
16 times in 3 months.
Yeah.
Yeah, and a couple of hours.
Right, because they even had restrictions on how many hours you can be out, right? So it's like,
yeah, now we can go outside at any time, but with all the precautions.
Mhm.
So I try to go outside like 1 or 2 hours.
Right.
Yeah.
Yeah. So in Guatemala, they basically had it was pretty open, but it was basically like a curfew.
Yeah, from 6 to 5.
But they clearly locked down a lot of industries, though, correct?
Yeah.
Like, I mean, people weren't allowed to work. Whereas in El Salvador, not only did they lock down all the industries in terms of not people being able to work, but literally not able to go outside. And as they've kind of started to phase into opening it a little bit more, there's been more cases, and so they're kind of going to go back to lockdown.
Yeah.
Right. Yeah. Yeah. Well, that's it's been pretty incredible to actually think of what that would be like compared to what we're experiencing in the United States. But then what you guys are able to do with that in terms of, you know, you've only been outside 16 times, but you have coordinated an incredible amount of response just from your home. So we'll get into that in a minute, more details about the actual disbursement and some of the relief efforts that have been going on. Ron, give us a quick overview of what's going on the whole way over in Nepal. What's the current situation there?
Well, Nepal, it's been growing steadily. You know, they're kind of isolated and there's very limited testing. So for a long time, it really was isolated primarily to Kathmandu as far as what they knew was happening. And it was in certain pockets of villages. But now it's been growing pretty steadily. In fact, since May 20, it's literally the steepest peak. It's straight up since May 20th. So they have reported over 11,000 cases. They've done over 250,000 tests, but everybody knows that it's 40 times probably that across the country. Right. So there is restrictions now, even between movement between states. You can't go from certain states to Kathmandu or Kathmandu to other states. So not only is it locked down kind of, you know, the borders, but even between locations, they have restrictions. Right. In case of just what it means for everyday life, they have 2 hours every morning to be able to go out and get their food and do whatever they need to do. It's real, like, limited window. Many of the markets are closed. Most of the businesses are closed. So really all that's available is food and pharmacy, and people literally very limited public transportation too. So people are having to find their ways to get around in that 2 hour window to be able to get their food and care for other people as well. Right.
But tell us then what has been the process for the local churches that we're working with of being able to actually, you know, get food and relief to the families that need it. Tell us a little bit about that and maybe even a few stories. And I think I've got some pictures on here that I'll try and throw up as you're talking. Sure.
Yeah, it's been amazing to see how these churches have been able to activate really activate care in their communities. And you can see some of the pictures here. But in the majority of the cases, the pastors and church leaders already had relationships together. So the churches were already working with the village leaders, and they had already identified those vulnerable families that they'd been caring for. So they immediately already had lists. Now, in the case of Nepal, the church cannot give a donation directly to a church. So they have to give the donation to the VDC, which is like their mayor's office.
The church, sorry, so the church can't give donations directly to the community. Is that what you're saying? Like
right, to the community or to a family, right?
Right.
So what they have to do is they donate it to the mayor's office, which is their VDC, and then together with representatives of the mayor's office and the church, then they go visit house to house.
Right.
So what they've been able to do then is, because the church community and the community leaders, the village leaders, already had these lists, they were able to go to the VDC and say, hey, these people have not received anything from the mayor's office. Is there any way you can mobilize resources? In some cases, the VDC then have responded and helped and gone with the church to deliver the food. In some cases, the church has delivered the food either through ENLACE or from other organizations to the VDC, and then gone back and distributed. So as you can see here, they've done it in 2 or 3 different ways. Sometimes they found a common, like in this picture, a common open field where they'll come and do it in safe spots. They'll put it in 6 feet of distance, and then one by one, the family will come and get the bag, like you see in this picture. In some cases, like this is just in front of the church. That's actually in front of the church right there. You can see where the pickup truck is. That's in Rampur. And what they've done is put the bags out in safe distances, and the families have come to get it.
Wow.
In some cases, they have been able to go and actually care for individual families. So for example, in the case of Kaman, which is a 67-year-old man who lives by himself and really has depended on the community to feed him for years. He's an elderly man, he cannot get around. In the case of Kaman, the church and community have actually gone and physically cared for him and taken food to his house, because obviously he can't get out to these more public spots. But as the church is connected to the community, it's been incredible to see the stories that of what they're doing, not only creatively working with their mayor's office, but also the families. Tina was talking about. Tina is the country director in Nepal. We protected her from not being on here because, as many of you know, the organization we work with in Nepal is a community development association, and it's really, we need to be very careful on how it's connected to churches and otherwise, so that we don't get them and the churches in trouble. But the stories that Tina has talked about are just phenomenal. Churches meeting this young boy named Bikram. He's the eldest of 4 children. His mom is a single mom and basically lives off of day labor. And because she hasn't been able to go out and find work either in a farm or anywhere else in the community, they literally have less than 2 days of food. And the church has been working with the VDC and the village leaders to care for Bikram and his family. You have other stories that, like Puspa, who's a 10-year-old girl who lives with her younger sister. Her parents are both immigrants to India and send money back to them. And because the parents are out of work in India, they haven't been able to send money back. So these 2 girls are basically on their own. And the church and village leaders have been able to care for them, make sure that someone's visiting them, making sure that they're not alone, but also providing food. So It's been really interesting to see how the church community are working together with the mayor's office. But also they have this 2-hour window. They have to coordinate everything to go, okay, we're all going to go to the field in this 2-hour period and distribute at this time. And so everybody can come and get their food. And the cases where you have vulnerable families that cannot be cared for, the church and VDC and village leaders are going to their house and making sure that they're cared for. So it's pretty incredible.
That's awesome. Do you have, I don't know if Eva has the numbers or if you have some numbers specifically about Nepal, Ron. I've been looking at the consolidated numbers here and there, and I couldn't see the breakdown between Nepal and the rest, but I mean, we're well over 1 million meals now total combined. But what about Nepal? What are the numbers there?
And Nepal I provide 65,000 meals.
Wow.
Yeah.
65,000 meals. It's absolutely incredible. And again, a lot of their service has been through local management, right, Ron, or Eva?
Yeah. Well, the percentage is almost like 80%. And we at El Salvador, Guatemala, and Nepal, the community and church leaders are being able to provide 1.6 million of meals.
1.6 million meals.
1.6 million, yeah. This is over 11,000 families, more than 55,000 people. Wow. So that receive food and hygiene supplies, and the percentage is almost 80% for mobilizing local resources.
Right.
Since the beginning, right? Because the next few months, this percentage is more. It's going to be less.
Right.
Right.
That's
so
incredible.
we knew. I'm just supposed to say we knew from the very beginning that the original government resources would come in. If anything was going to be given, it was going to be given at the very beginning, and nonprofits were going to respond as well. So our key issue was to train the church communities to identify those families in greatest need and be able to get those resources to them.
Right.
We also knew that this would probably be gradual. So as the number of families increase as well, and as the resources grow, then our resources will become even more significant in the process over the next 3 years.
Right.
3 months. Care for these families. So yeah, I think of Eva, what is the exact to-date number that ENLACE resources have funded? How many meals have actually been given from church and communities through what we have currently funded?
Yeah, it's 3,050.
Or no,
300,
families.
Yeah. 355,000.
Oh,
355,000 meals. Yeah.
Meals.
Yeah.
Meals. Yeah.
355,000 meals. That's incredible. But yeah, so the local, then the local, what they've locally mobilized is 1.3 million meals.
Yeah.
And so that's absolutely incredible. And again, I actually thought at first when those numbers were so big that it was kind of like that we were counting some of the resources that were going nationally, in other words, from the national government getting to everybody. But from what I understand, that's not included in here. This number of 1.6 million is literally, the 1.3 million is literally what they have mobilized on their own between church and community. So absolutely amazing.
It's
that
like
means from companies. That means they're approaching companies, other nonprofits. They're working with local mayors' offices, but these aren't the federal programs that are giving out to everybody.
Right.
I'm sorry, Eva, I didn't mean to cut you off. Go ahead.
Yeah, at Berseba Church, since the beginning of the crisis, the community and church leaders create a plan to respond to their families in greatest need. So mobilizing their local resources with other organizations, not with the government. This is really a part. So
that's incredible.
From the beginning, they start to create a plan to respond.
Yeah. Is this from Berseba? This
is from Cocalito.
Oh, that one's Cocalito. Okay. So,
yeah, this is Guatemala.
Yeah.
Yeah,
that's
this
incredible.
is Metalillo.
And that one's Cocalito too, right?
Yeah.
Wow. Yeah. So what has this process been like so far, Eva, in terms of trying to mobilize even the staff, the ENLACE staff to get out and be a part of this? Tell us what it's been like.
Yeah, we will expect to continue this stage for 3 months to support more than 3,000 families.
That's incredible.
Yeah, the work that the church and community leaders it's been incredible.
That's awesome. And we saw, like here at the beginning, I had this one picture, if I find it, it's kind of become more well known that, these white flags, what tell us about the white flags and why people are flying white flags?
Yeah, they put the white flags where like a sign to we don't have food. So at El Cocalito, after when they deliver the food packets, all the families that they give the food already have the white flag. So this was really impressive for the community and church leaders.
Right. Yeah. Wow. Yeah. So pretty incredible to realize there's like 1.3 million meals that they've mobilized locally. Ron, tell us about moving forward, what like the collaboration is going to look like. I know we've got some collaborations going on, and how's that going to work, and what do you foresee the next steps are?
Well, because we knew this crisis was so unique, not only do you have more families becoming more vulnerable or dropping into areas of need or need for food, and we knew it was going to be 3 to 4 months, 3 to 5 months before people could get on their feet. We knew we needed to really try to figure out how we could respond at a bigger level. And so thanks really to the level of organization from 4 organizations, Tier Fund, Life Church, Viva Network, and Convoy of Hope, along with ourselves, really try to figure out, we're all working in the region. We've all been committed for multiple years to really building these networks of church and community leaders. We just kind of put our minds together and figured out how can we really share experiences and learn, but also to partner together to be effective. And we've got this collaborative effort where we're trying to reach and serve 6,000 families over the next 3 months. So in other words, 6,000 per month for the next 3 months. It's 1.5 million meals. So we just had an event on Tuesday that's a webinar that I think you still go back and look at. We'll put the link in here, but there's also a direct way to give to that. So we're trying to see how we can really, not duplicate effort,
Right.
but really provide the right tools for church communities to identify those families in greatest need and be able to serve them over a 3 to 5 month kind of period, so that they can actually begin to get back on their feet and recover.
Awesome. Yeah. And so in the 1.5 million, that's basically what ENLACE would be distributing, correct? The 1.5
No, that's total. That's total, all organizations.
Okay.
So we would be caring for, of the 6,000 families, we would be caring for 1,500 of them. And then we'll add our additional resources. Like Eva said, it's almost 3,000 families that we're trying to care for on a month-to-month basis. Right. So this collaborative would go to taking us about halfway to where we need to be as far as all the communities we're serving.
Yeah, awesome. So when those resources, God willing, begin to come in, Eva, what are going to be the next steps on the ground, and how do you foresee, ENLACE continuing forward to be a support?
Yeah, well, now are focusing on work alongside with the church and community leaders on the relief stage, right? So they have been able to respond, providing food, hope, spiritual and emotional support too.
Right.
So see how they are responding. It's very awesome. Some Guatemala churches from the West and Southwest region, after they provide food to their families, they ensure emotional and spiritual support within the next 15 days.
Wow.
So during this period, they conduct home visit and prayers. The same situation at El Salvador, they are doing this too. So now we expect to continue the next 3 months. So to support their families. Yeah.
That's incredible.
And then while we're doing this, Dave, just to add to what Eva's saying, we're already starting to try to help church and communities think through 2 areas of recovery: agriculture assistance and microfinance or microenterprise development. In the case of agricultural assistance, most of our farmers have to cultivate by June. So they're already, if they have not done so because they didn't have the resources or income to buy inputs, it puts them behind on the cultivation season. And which means that when it comes to May, June, July of next year, they're going to be really hurting because they don't have the basic corn and beans that they use for everyday sustenance. So what the church and communities do right now are figuring out who got inputs, who's farming currently, who were not able to get inputs for whatever reason, either because they couldn't get out and get them, or they didn't have the money to buy them, or they didn't get them from the government, and try to figure out how we can supplement that and at least be able to guarantee the second round of crops, which would be July, August, so they have some coming into next year.
Right.
And that's what we're working on currently with those church and community leaders. As far as microenterprise development, we have a credit union on the ground who's in the process of thinking through each one of our companies. In many cases, we've worked 12, 15 years with these companies to get them up and running. So we're actually looking to do microfinance recovery loans, which is a small amount of fresh capital so they can get going, so they can they can start generating employment. But we're also looking for different opportunities like that out in the communities we're working with. How can we re-incentivize some of these companies? So that's kind of like the medium to long-term goal, but we're getting the pastors and churches to think about it now, because they've got to get their second plans ready to be able to activate them in July, August, September.
Right. Yeah. It's absolutely incredible. And basically it's the full picture, right? We're going from relief to recovery to development, and all the while talking about transformation, and it's been incredible, as Eva was telling us, the ways in which these churches and communities are collaborating to make this happen. And so, and as Ron was mentioning, this idea of feeding families for these next few months, right, as they kind of filling in the gap between when the harvest season will hopefully come, here in the fall in the United States. Hopefully they'll be able to be being able to cultivate and harvest food for themselves, especially in the really remote areas here over the next 3 or 4 months. So in filling in that gap, has been doing this collaboration through that Life Church helped us to coordinate, is coordinating the whole process, and then distribution through Convoy of Hope and Tier Fund and Viva Network, as Ron was talking about. I think that is really going to help fill that gap of these next few months that we're moving into. And so I do encourage you to check out Ron and Eva. We're both on this webinar, this webcast. We'll throw up the link on there. If you didn't get a chance to see it on Tuesday, you can check that out, which kind of gives a good overview. And there were a few other really good contributors on that hour-long webcast. So yeah, thank you guys so much for all that you are doing. Eva, you're a superstar. You've been doing an incredible job for years with ENLACE. And now it's just incredible to see the way that you've stepped up as a leader, helping to lead all of the efforts across all 3 countries. But also the way that the other staff members have stepped up and responded as well, filling out new roles, doing some things that they were not accustomed to, and all the while being, cooped up in your houses. Please know that we appreciate you. We're praying for you. And there's a whole lot of supporters right here now watching this that are also praying for you guys and cheering you on as you are cheering on these pastors and church leaders to continue to bring transformation. So Ron, I just want to comment one thing. You got the on-air sign, and that is pretty sweet. You shifted
a gift from my family, so that they know when I'm on air.
That's pretty awesome. Yeah, because I've been on, I don't know, maybe 100 Zoom calls with you over the past 2 months or so. No, but usually it's just that those doors, the French door things behind you, So now we got the on-air thing. This is a whole new perspective on life. But yeah, and I totally
evolving, baby. We're always evolving, changing, making things new, baby.
Yeah, making things new. Ron, I don't know if you have anything else you'd like to add before we close.
No, I just want to thank once again all of our amazing church partners and individual donors and friends that have been with us for years. I mean, it's when this thing hit in March, there were about 10 days where I think we all kind of looked at each other and thought, okay, so what's going to happen? We knew we weren't going to be able to have short-term teams, which is such a huge blessing for us to engage U.S. partners and to really serve on the ground. We didn't know what was going to happen as far as kind of the rest of our partners knowing that they were also suffering from job loss and changes in their own conditions as far as life in the States, and churches not knowing what was going to happen to them. But it's just been so encouraging and just overwhelming for us as a team to see so many church partners reach out to us, have deep conversations with us, encourage us, care for our staff, be asking about how they're doing, praying for them, and then also just responding in the most incredible ways for us to continue to do relief and recovery. So, in all of this, I keep talking to the team about really keeping a balance between grief and hope. You see the families and you're overwhelmed. At least I've been overwhelmed. I know our staff have been overwhelmed to see the level of need on the ground, but then also just hope in that God is doing something and he's moving in people's hearts and he's there with them. He's there with these families through the pastors and leaders, and he's with us as a team, as our partners and friends continue to partner with us and stay, close to us. So I just want to, stop and say all of this, the 1.5 million meals, which is all the effort of these pastors and community leaders together, is in great part due to our amazing friends and partners and donors. And thank you. We're throwing everything we can in it in the best way we can, but I know it's because of your prayer and giving faithfully, but also giving sacrificially and believing in us. And we just thank you so much.
Yeah. Awesome. And it has been really incredible just to see the way in which God's providing in the midst of this season, and he's providing through our partners. And yeah, it's absolutely incredible to just see how people are stepping up and doing everything from running 5Ks to start training for half marathons to joining up on the coffee program and everything. I mean, God's really just been providing in pretty incredible ways through this season. And Eva, I'm going to put you on the spot. Would you mind praying for us as we go out? You can feel free to pray in Spanish for us, and just a nice short prayer.
Okay, I will sure do it in Spanish.
Okay, perfect. Thank you,
Okay.
Eva. Let's pray.
Señor, te damos gracias por la oportunidad, Señor, que nos das de compartir. Te agradecemos por cada líder, Señor, por cada pastor, por cada comunidad que se encuentra trabajando fuerte, Señor, en esta crisis. Te damos gracias por todas lo que podemos aprender de ellos. Te pedimos por todas las personas, Señor, que están viendo este programa. Te agradecemos por cada donante, por cada iglesia, Señor, que se compromete a acompañar a estas grandes iglesias y comunidades en Guatemala, El Salvador, Nepal. Te agradecemos por todo su compromiso y por su amor a los demás. Te damos gracias, Señor, y ponemos en tus manos a todos nuestros pastores e iglesias que se encuentran trabajando en los diferentes países. Amén.
Amén. Muchas gracias, Eva.
Amen.
Gracias, Davidcito. Bendiciones a todos.
Yeah,
Gracias.
blessings to all you guys.
Thank you.
Thank you again. God bless you.
Talk to you later.